This presentation is entitled Substance Abuse in Older Adults. I will begin the presentation with an explanation of the importance of this topic for counselors and counselors in training. The number of Americans aged 50 and older with substance use disorders has been on the rise and is expected to double, reaching approximately 5.7 million by the year 2020. As of 2013, baby boomers made up 30% of the American population. This aging generation has had greater exposure to illicit drugs than previous generations. Adults aged 65 and older are the fastest growing age cohort in the United States. This age group, in addition to being the fastest growing, is also the least likely to perceive a need for treatment. Alcohol is the most common substance abused among older adults. The misuse of prescription and over-the-counter drugs is also prevalent among older adults. Prescription drugs are often misused unintentionally due to factors such as confusion and the management of multiple disease processes by multiple doctors who do not always coordinate patient care. Older adults consume an estimated 25 to 30% of prescribed medications in the United States, which puts them at a higher risk of overuse and misuse of the medications. Older adults are uniquely at risk for substance abuse. The loss of social and emotional support systems is not unusual in aging, and isolation and depression can exacerbate substance abuse. Substance abuse in older adults can be categorized as either early or late onset. Approximately 2/3 are categorized as early onset, meaning that substance abuse develops before the age of 65. Late onset substance abuse, on the other hand, begins after the age of 65 and usually develops in response to a negative life situation or event. Some examples of events that might lead to late onset substance abuse are retirement, the death of a spouse, or health issues. Late onset substance abusers generally have a better prognosis for recovery due to better health and social supports, neither of which have been subjected to as long a period of drug or alcohol abuse. Older adults face a number of barriers and challenges to seeking treatment for substance abuse. One of the most frequent barriers is cost of treatment and/or limited health insurance. Other challenges are a lack of readiness for treatment, concerns about stigma or confidentiality, beliefs of self-sufficiency, and a lack of knowledge about treatment programs. Denial can also present a significant challenge, particularly for older adults who have used substances for many years. It may be difficult to acknowledge the harmful effects of the substance or substances, many of which increase with aging. Additionally, for some older adults, a foreshortened sense of the future may inhibit the motivation to quit. Finally, family, caregiver, and clinician complicity is an exacerbating factor. This phenomenon has been labeled the nice little old man or nice little old lady syndrome. Families may view the substance use as embarrassing or see it as one of the last remaining pleasures in the older adult's life. This nonchalant attitude is quite dangerous, as older adults with substance use disorders are significantly more likely to die of suicide than their peers without substance use disorders. Screening challenges are significant when it comes to detecting substance abuse among older adults. In fact, substance abuse in this population has been called the invisible epidemic. Similarly, older adults have been called the hidden population. As such, older adults are often isolated from many of the traditional methods of detection. Many do not drive and are therefore unlikely to be picked up for drunk driving. Many are retired, which limits the presence of job-related problems. Many are likely to view alcohol and drug-related problems as a moral failing due to the cultural messages they have received about substance use throughout their lives. This association of substance abuse with a moral failing may make older adults less likely to disclose their problem behavior. In addition, diagnostic criteria may not be appropriate for older adults. For example, tolerance may not apply due to age-related metabolism changes. Older adults experience loss of body mass, which results in more profound effects of smaller amounts of drugs or alcohol. The age-related decreases in absorption rate of the gastrointestinal system, combined with decreased excretion rates, mean that drugs and alcohol remain in the body longer. As such, older adults may not demonstrate the tolerance criteria due to age-related physical changes. As mentioned before, changes in school and job functioning may be irrelevant, as may be diminished interest in activities and hobbies, which may be written off as a natural part of aging. In fact, many effects of substance misuse are masked as characteristics of aging or other medical disorders. Often memory loss, confusion, depression, unsteady gait, hostility, and changes in appearance are chalked up to normal aging. This contributes to underdiagnosis of substance abuse and dependence in older adults. Screening is also less common for middle and upper class older adults due to the myth that substance abuse is a disorder of low-income populations. Older adults may specifically avoid mixed-age treatment, the primary type of treatment available in the United States. Only 17.7% of drug and alcohol treatment facilities offer elder-specific programs, revealing the need for age-specific treatment programs. Age-specific treatments can incorporate physical and cognitive accommodations and address life stage concerns, stressors, and vulnerabilities related to late life, such as loneliness, grief, and loss. This is especially important as loneliness and grief are commonly reported reasons for substance use among older adults. There is a need for mobile health interventions, particularly for those with transportation or mobility issues. Mobile health interventions can additionally address isolation and concerns about stigma common among older adults. Finally, for older adults who have not yet begun to abuse drugs or alcohol, clinicians are urged to focus on prevention and education. These initiatives can be successfully integrated into primary care settings. Morgan, Brosi, and Brosi cite the benefits of the use of narrative therapy with older adults who struggle with substance abuse disorders. They suggest that ageism serves as the dominant cultural narrative for older adults, and that combined with the shame and isolation related to drug use, negatively impacts older adults' self-narratives. Narrative therapists utilize 4 main techniques that are pertinent to working with older adults who have substance abuse disorders. The first is the deconstruction of the dominant story, which in this case would be ageism. The second is called externalizing the problem. This practice of constructing the problem as external rather than an internal flaw can be particularly helpful for older adults who are likely to see substance abuse as a moral failing or personal shortcoming. The third technique is identifying unique outcomes, or times when the client was able to respond adaptively. The fourth technique is reconstruction. In this phase, the narrative therapist focuses on reinforcing the new, more adaptive story. The counselor can assist the client in identifying relationships and individuals who can reinforce the new story, which serves to facilitate social support and connection, which are so important to the well-being of older adults. How can we, as counselors in training, best prepare for work with this population? First, counselors are encouraged to have full knowledge of the aging process before beginning any work with older adults. It is also important for counselors to understand factors related to resilience, wellness, and happiness in older populations, so that those resources can be encouraged and supported. Counselors are urged to seek continuing education specific to substance abuse in older adult populations, and clinical supervision should include accurate information about the growing elderly population. I hope that this presentation has been helpful and informative.